Like if they can vaccinate Batabile Dlamini live on TV, and I survive a Google, then I'm more than willing to take the vaccine.
Express Online, Express Online, Express Online, Express Online.
Yo guys, what's up? Vince SP here. Hope you're all doing good. I'm also good. Let's engage on another serious matter. Big issue, this one. Everyone is talking about it. Let's talk about vaccine. Will you be taking the vaccine or not? Or is it a vaccine here, COVID or I and if we're out, why was it that? I would like to know. Hit us up with your comments. Let's decipher this issue of vaccines. I mean, we had President Cyril Ramaphosa coming out the other day talking about vaccines, throughout the entire family meeting, briefing us about vaccines. Hey, we must take vaccines days. Hey, they are procuring vaccines from Kai. It seems like now this vaccine story is real. It's real. Are you going to take the vaccine or not? Voluntary so, or you want to be forced to take the vaccine? Interesting issue. Let's get into it. So, one can ask, what is a vaccine, Vince? I'm just going to give you an explanation I got from reading online. So this is what a vaccine is. A vaccine is intended to provide immunity against COVID-19. So in general, vaccines contain weakened or ineffective parts of a particular organisms that triggers an immune response within the body. This weakened version will not cause the disease in the person receiving the vaccine. Again, let me repeat that. This weakened version will not cause the disease in the person receiving the vaccine, but it will cause their immune system to respond. Some vaccines require multiple doses given weeks or months apart. This is sometimes needed to allow for the production of long-lived antibiotics and the development of memory cells. Let's go. Rewind and listen to that so that you can have a full understanding of what this vaccine is. So in this way, the body is trained to fight the specific disease causing the organisms, building up memory against the pathogen so it can fight in the future. Yeah, from now you can call me Dr. Vince SP. So are you going to take the vaccine or not? I mean, we had Cyril Ramaphosa coming out talking about the vaccine. We had also a person from the EFF leader, Julius Malema, who was saying he's going to be the first person to take the vaccine. And just today, Desmond Tutu came out on some, everyone should take the vaccine. Hey man, Desmond Tutu is like, no, everyone should take the vaccine. Just today, he came out today saying everyone should take the vaccine. Are you going to take the vaccine or not? What are your thoughts about this vaccine issue? I have a few voice notes that I want to play so that we can hear from people what they think when it comes to these vaccines. Let's hear what he has to say.
And yeah, my take on vaccine, I'm still a little bit caught up between things in terms of like whether it's a good thing or a bad thing. But from my own personal view, I wouldn't take vaccine as in like tomorrow if it were to be rolled out tomorrow. But I think I would also look into clinical trials passing and seeing it like happening, people being okay and all that. And I could definitely opt out to take it at the later stage. But at this point, no, I think I'm not going to take it. Thank you.
He'll be saying no, but then let it go through some trials first. right? Let it go. Vince, I don't have a problem with it. I can take it, but let it go through some trials first. I understand what Happy is saying. Clearly, I understand what. But then, the thing about these vaccines, the talk about vaccines that they bring fear to most people. People are scared now when you talk about these vaccines. Portia, talk to us.
Portia, being honest, I'm so scared. I'm scared and I'm confused because of this lot of information that is roaming around about this vaccine. But my main reason is because they made this vaccine in a short of period of time. So they are not sure, 100% sure about the side effect. So since well, I'm an allergic person, I will wait a little bit. Maybe during the year, I will think about it. But for now, it's a big no-no.
So it seems like people don't want to be the first ones to get the vaccine. They're like, nah, Vince, I'm not flop leona, but then a few people buy pele, then after, that's when we can get the vaccine. When you say few people buy pele, who should go first? Well, I heard Julia saying he will go first. I think Bonolo might have the right person who will have to go first. Bonolo, talk to us.
Clement Heinrich was company. And like if they can vaccinate Batabile Tlamini live on TV, and I survive a Kukola, then I'm more than willing to take the vaccine. Just take Batabile Tlamini and vaccinate her live on TV. You can vaccinate me anytime. Government taking about that.
Bonolo says, no, Vince, no. But I Pele. Why Batabi? Why Batabi? Let them start with politicians first. Let politicians get it first. I mean, they are our leaders, guys. Go first. Go first. After 6 months, then we can talk. Mono says, no, let Batabi start receiving the vaccine. Then after that, definitely, she can take it. Hey, detail, guys, detail. But then it's shocking. I loved what Portia said regarding that she's scared. She's not the only one who's scared. A lot of us are scared. What I think is going to happen, yes, now they can say this is going to be a voluntary type of a thing. But I foresee them coming out and say, now this moved from voluntary to being mandatory now. Now everyone will be forced to take the vaccine. I see that happening. I see that happening. Well, in terms of what they are saying, who's going to take the vaccine first, I mean, there was a list in terms of who is going to take the vaccine first. So, where is my list? Where is my list? Yantimella. But obviously, we heard that people working, frontline workers are the one who will take the vaccine first. These are your doctors, people who are actually at the forefront, people who should be working at the level. Also, there are some criteria that they are looking into in terms of procuring these vaccines from outside, because we don't have doctors who are developing vaccines. Come high, lengana se vaccine, Victor the vaccine. So reggae the vaccine outside. Why can't we have our own? So this is the process or the criteria that they are looking into regarding procuring the vaccine. They are saying they are looking into issues that does a supplier have stock available? Is the vaccine safe, effective, and of good quality? How easy is it to use, and how many doses are required? You see, the doses part. What if it says 9 doses on a monthly basis? 4, can it be easily stored and distributed? On a tracker security, hey, it doesn't have to be stored like this in a box. Hey, you can't send take it out, guys, to just say. 5, does the supplier have capacity to produce the volumes needed for South Africa's rollout? And also the last one is, how much does it cost? So that is the procurement criteria that they are looking into regarding this vaccine things. Now, let's hear some voice notes from Bill in terms of what he has to say regarding this vaccine. Are you going to get vaccinated or not? Mabi, talk to us.
The medicine or the vaccine, I can only use the vaccine that is being scientifically generated in South Africa or Africa as a continent by black scientists or any African doctor or scientist in Africa. As from something that comes from Europe, China, or wherever, I'm not going to use it. And I advise everyone not to use this vaccine. I rather to rely on the roots medicines that we use. Example, lengana, pligom, kokopa, those kind of things. Because people are dying in the hospital while they're using this Western medicine. So I'm not going to be, it's a trap, period.
Yo! And it's a trap. That's not me. And it's a trap. Why can't we produce our own vaccines? And I mean, let's be real. We have the Dr. Tagamohaika. We have African traditional healers, right? Why are we not allowed to utilize their medication? Is it because of it's not mandated by World Health Organization that we cannot use them? I mean, we use lengana kamohai, raramela, ka vix le metsa office. So no metal fees again, another present. We can't use it. If I'm wrong, hit me up and say, no, Vince, you're wrong. And your entire list of voice notes are wrong. This is why you should use the vaccine. We are sourcing out information here. I just can't take something in my system and just say, it's fine because of this, that I should use it. No. Rabonzan. Why should we use it? Give us reasons enough. Give us reasons enough. Shonza, let's hear what you have to say about regarding this vaccine.
Because of the express of life. As when it comes to the vaccine, I'm one person that I would be happy not to take it because of I'm not sure I can trust other scientists that don't come from Africa. Maybe if ever our African scientists were to check the vaccine and make sure that the vaccine has been correct, then I would take it. But then for such reasons, I wouldn't be taking it. I don't trust it. Thank you. Enjoy.
Shoni says no. Why can't we have our own scientists doing the vaccine? Why do we have to procure these vaccines outside from India? Why can't we have our own? It's a good question. Why can't we have our own? It's a fair question. Fair, very fair. Basta. Let's hear.
Well, I for one won't be taking the COVID-19 vaccine. Why? Because there's a lot of rumors regarding the vaccine. But besides that, I think should I be infected with COVID-19, I'm going to isolate myself at home and try all the remedies and all the concoctions to make sure that I get better. But when it comes to taking this vaccine, I'm not going to take the vaccine. I'm okay with that. We have a lot of questions regarding this vaccine. Not that we're doubting our government or anything, but how come was it found or formed so quickly when we're looking at the fact that we're still struggling as the world to find the HIV and AIDS vaccine, the cancer vaccine, as well as the common cold flu? How come did the COVID-19 vaccine be formed so quickly? So that makes me so skeptical. I'm not going to take that vaccine.
People are questioning now, and they need answers. We need answers. Give us answers. Please give us answers. Tando, talk to us.
Me once again, with regards to the vaccine, honestly, I'm on a yes and no effect. Ngoba. I'm thankful that I'm on the other, which is the third phase of the vaccine. So I'm keen to see how it's going to treat people. So if it treats them well, then I'm definitely taking it. You know, if not, then I'm definitely not. So the question of whether I take it or not really depends on how it's going to treat other people. Thank you.
Tandor, no, Mpeng. Okay, Sharp. How many people are you going to put in? 20. Mpeng number 15. Mpeng number 15. Don't start with me. Neo, let's hear what Neo has to say. Talk to us.
What a question. What a question. Will I be taking the vaccine? I guess you're referring to the COVID vaccine. So here's the thing, with the little knowledge that I have, what I heard is that when you create a vaccine, you have to take a DNA from the virus or from a person who's infected. But now with this vaccine that is, with what I read, with this vaccine that is created, the DNA template used does not come directly from an isolated virus, from an infected person. Now, the statement begs the question, so where does the genetic material being put in the vaccine actually come from? So when we take the vaccine, where does it come from? Where do they get this genetic material in the vaccine?
Give people answers. I'm sure you can play back this video so that you can get a lot, regarding what people are asking about. Are you going to take the vaccine? Hit me up with your comments and let's engage on this matter. So from me, Princess P, peace and God bless you.